Hey, my name is Raul. I'm a student nurse, and today, right now, we're going to be working on our first patient, and we're going to be inserting a straight calf to check for PVR, post, void, residual, one right now, as what the doctor's orders are stated. First, we're going to get our kit. We're going to open it away from us. We're going to take out the sterile gloves. Sterile glove technique. We're going to open up. 1-inch borders. Now I'm going to grab the inner cuff with my right hand because I'm a lefty. I'm going to slide these on away from the table so it stays sterile. One's on. Now I'm going to go in the inner cuff here since these are sterile gloves, and I'm going to slide my hand in away from the area I'm working so that I make sure that my gloves remain sterile. All right, now I'm going to fix with my left hand. Don't want to tug on them too much. There we go. If they're on, they're on. Now I could discard this above waist. Discard. Now everything within my kit is sterile, so now I can take it all out. And since my hands are sterile, everything's fine. Now I'm going to place this over my patient. Right here. Never go above my stuff that's sterile here. Once everything's there, go around it, never above. So now I'm going to grab this. Shiny bottom's always going to be in the bottom. Shiny part's always going to be in the bottom here. So we're going to go there. Everything's still sterile. We're not getting a sample, so we're not going to need this. So if we're working on a male, we have our swabs, our cotton tip swabs here, which are going to be for cleansing. So with this, you'll go around the meatus of the penis from top to bottom, going in circular motions each time. Also turning the Q-tips so that we make sure to clean the whole area. If there's foreskin, we'll make sure that we pull back gently, clean area once we insert catheter and everything. At the end, now we put back the foreskin in the original position. Here we have our lube, so we're going to hold that. We have our catheter, still sanitary, still sterile. We're going to open this up, put our lube inside of our tray. Now we could discard of this. Discard. Now what we are going to do, we are going to lube up our catheter. Now we're going to switch sides real quick. We're going to hold this like this. And what's going to happen now is that this is where the urines can come out of, and this is the insertion point. So now we're going to bring our tray over. Here, we're going to insert the catheter. All right. So for a male, we have a male patient. We're going to pick up the penis. We're going to insert it. Making sure the whole thing is sterile. We're going to insert, insert, insert. Now we're going to keep it there and hold it. Hold it for him. Wait a little. We could palpate gently at the abdomen to make sure we get all of the residual out. Okay. Once we're done, we'll be like, okay, blow out your birthday candles. When he blows out, gently pull out. Now we're done. We emptied out the bladder. Now on the sides, we could measure here. But now this is all done, so what we will do is that we'll collect it all together, gather it up, and we'll throw it out. Now let's go from the gloves. Go underneath. Gloves, also the garbage. That's our first patient. Next, now our doctor's orders to move. We have a second patient, and the order for that one is to obtain a urine sample for culture sensitivity, and our patient has an indwelling catheter, also known as a Foley. So now this is not a sterile technique. We are going to be putting on our gloves, clean gloves, because it's always going to be for our safety. And if the fluid's not yours, don't touch it. Clean gloves. So Foley's in. Now we need to get a sample. We could get a sample from two areas. We're going to get it from the port today, which is this area right here. Or we could get it from the bottom of the bag. There's an open and closed seal there. First, what we're going to need here is our jar. So we're going to have that open. We're going to need a 10 ml syringe. So that has a lower lock because this has treads here, so we could turn on. So what we could do is we're going to have this. We're gonna have to, before we obtain our sample, we're gonna have to clean the port, at least for 30 seconds. Clean around the port, clean before inserting. Now we're gonna insert it, and we're gonna have to apply pressure, turn because it's lower lock. Now it's safe there. So now with this, now we're gonna look, make sure there's no kinks, so that we could get our urine sample. So here we're gonna go. Oops. So what I'm gonna do here. Urine's going through. I'm going to kink this with my right hand, and I'm going to be waiting for the urine to build up in this tube here that's kinked. Once it is built up, I could obtain the amount that I need. In this case, we're going to take 10 mLs. Now we're going to release so the urine flow can continue. Uncap. Now we're going to go above the jar, not inside, and we're going to release urine sample. Now we could discard the 10 ml syringe and we could close. Now I'm going to label this with my name, date, patient's name, and then we're also going to be putting it inside of a biohazard bag. Also, we're going to label this with our name, date, patient's name, date of birth, and we're going to send this out to the lab for testing. Could discard these. Discard. Now for our last patient. For the last patient here on our doctor's orders, we have a patient who's experienced dyspnea. Dyspnea is the difficulty for breathing. It's labored. The assessments that we're going to be performing, we'll probably be performing an assessment on the lungs. We're going to be listening to the lungs. We're going to be listening to the chest, the back and front, anterior and posteriorly, and also not to forget the right middle lobe. So it's going to be the right side under the axillary. We're going to be checking for nonverbal signs for pain. We're going to be seeing if our patient is using any accessory muscles. We're going to check their posture because sitting upright will help expand the lungs. Slouching over is not the best. We're also going to check for posture. If the patient needs to be in tripod position, that will help. I'm sure I said no use of accessory muscles. And we're also going to make sure and check for a mental health assessment to make sure that our patient is orientated and will be able to speak with us and knows what's happening. So we will check those via times 1, times 2, times 3. Times 3 being to person, place, and time, which will probably be best for us. But we'll do a mental health. Next, the equipment we'll be using a stethoscope, so we can be listening to the lung sounds. We're also going to be probably use a scale for scale for pain and discomfort. A numerical scale, 1 to 10. Tell me where your pain is on this scale. We will check for vital signs, always check for vital signs. We will be bringing a BP cuff and a pulse oximeter, so we could check for oxygen saturation and their blood pressure, which will help give us more vital signs. Also, some equipment we'll be bringing is probably maybe a TriFlow, which is to help to breathing exercises to help expand their lungs, to help open up the alveoli, because that's where diffusion is occurring between oxygen and carbon dioxide. Also, so now for SBARS finding, so vital signs here that I have on our patient who's a 74-year-old Caucasian woman. Here, her temperature here that I had taken down on my doctor's order. I have taken down her temperature is 80 degrees Celsius. Her heart rate is at 82 beats per minute. Her respiratory rate is at 18, and her BP is going to be at 157/64. And I have from the pulse oximeter, I got 85% oxygen saturation on room air. So that's the range that we are looking for is between 94, 95 to 100%. That's good breathing. That's a good amount of oxygen that's being carried by the hemoglobin. But now when the findings I'll be letting the doctor know through the SBAR format will be, my name is Raul. I'm the nurse that's assisting Mrs. Jones, this patient in room 309 in building 4. I noticed that she has difficulty breathing. I checked her vital signs. These are her vital signs. I'll repeat that off to the doctor. And I'm concerned with her breathing because I've noticed the vital signs that stick out to me are going to be respiratory rates, oxygen saturation, and her temperature is 80. So that means her extremities could be cold. Her skin could be cold. There could be signs of cyanosis. She could be cyanotic. Her mental state is she's at good mental state. She's orientated. Her limbs are slightly cold. Her temperature is 80 degrees Celsius. So her extremities are a little cold. I see a little bluing and paleness around her lips. So I believe these problems are respiratory related just by using my vital signs. Also, for interventions, I will tell the patient and help the patient with breathing techniques. Make sure deep breathing to expand her lungs. Make sure she's sitting upright. Also, slight exercises depending on her mobility. We'll be coming up with like a short exercise, maybe going up and down the steps. She's going to be experiencing shortness of breath because her chief complaint was for the past 2 weeks shortness of breath. Also, what I'm going to be documenting is going to be in SOAP, so I'll say my patient's name, the subjective, what she's feeling. I'll give that whole plan out, and I will also be initialing it with my names, with RV, and I will be giving the time and date when everything occurred, and I will be submitting this onto the computer and notifying the doctor.